Did you scan that way? Did you scan that way? Hi, my name's Cheyenne. I'm a student here at the College of Nursing, and today I will be demonstrating an NG tube insertion. So first, I'm going to verify my patient's order. So we have insert Salem pump and connect low, intermediate wall suction. And I'm going to check my hospital policies as well. So now I will perform hand hygiene, and I will identify my patient using my two identifiers. We have Jaguar Jones, MR number 4176352 and 4176352. And I see right here that he is allergic to penicillin. So now I'm going to explain the procedure to my patient to relieve any stress they may have and pull a curtain for privacy. So now I will gather my supplies. We have my tape, alcohol pads, scissors, lubricant, gloves, tongue compressor, goggles, my NG tube, pulse ox, a basin, a cup of water, and my towel. I would have my 60 milliliter syringe, however I do not have that. And I have my stethoscope and pen light right here. I will don my goggles, perform hand hygiene again. I will raise my patient's bed up to a working level, lower the side rails, and assess my patient's O2 levels and their vital signs. At any point during the procedure, if my patient's O2 drops or their vital signs decline, I will stop the procedure and wait till they are stable before I begin. Now I did my own hand hygiene. Raised my patient's bed up to a high Fowler's position, and I establish a cue for my patient in case they want me to stop, they feel any discomfort. So my cue is just going to be them put their hand up, and then I will stop. So now I'm going to open my NG tube container, put a dot of water-soluble lubricant onto the paper, and then I would get my 4 tapes ready. I have the measurement tape, the temporary fixed tape, the final fixed tape, and then the label tape. And then I would loosen the plunger on the 60 milliliter syringe by just pulling it back and forth until it was ready. And now I will perform hand hygiene and don my clean gloves. Prior to donning my clean gloves, while I was assessing my patient's vital signs, I would auscultate their bowel sounds with my stethoscope before beginning. So now that I have my clean gloves on, we will assess the patency and select one of the nares to do. So to do that, I'll get my patient to occlude each nostril alternating and just breathe normal. So we have chosen the right nostril. So now I would get my tubing and we would measure, going from the patient's nose to the earlobe down to the xiphoid process. I will be doing that in a different video. So we have already got the measurements measured. So we will take the tape right here, and they were at about 50. So I will dog ear tape it so it is easily able to be removed. And then I will place the towel on my patient's chest and the basin on my patient's abdomen to put the end of the tubing in and to collect any emesis. So now we will twirl the tube around my finger to conform it. And then I will replace the tape, the dog ear tape, at my marking, which was at 50. Conform it around. Now we will leave the first 4 inches of the tubing. So now I will wash my patient's bridge of their nose with soap and water and pat it dry. For insertion, I will get my patient to tilt their head back up against the pillow. And I will insert the tube after I've leaved the first 4 inches with the pointing downward. Once I get past the nasal pharynx, I will Once getting past the nasopharynx, I will have my patient relax their head and lean forward while sipping some water or dry swallowing if indicated or if necessary, and I will advance 1 to 2 inches each time while twisting 180 degrees, inserting, and twisting at 180 degrees. Until we reach the mark sign. If for some reason while I'm inserting the tube, if at any time they start to cough, feel any respiratory distress, if their vital signs or anything drops, I will pull the NG tube out to the posterior nasopharynx, wait for normal breathing to resume, have my patient swallow again before I reinsert the tubing. So now we will use our temporary tape and tape it to our patient's cheek. Have that right there. And we will assess to make sure it is in the correct spot in the throat. So we will use our pen light and the tongue depressor and look in their throat to see if it's in the correct spot. I will connect the 16 milliliter syringe, take this off and connect the 16 milliliter syringe, and to assess for the positioning of the tube, make sure it's in the right spot, we will either aspirate gastric contents, assess the pH levels if indicated, and then get a chest x-ray if it is ordered. So now that it is in the correct position, we will remove the dog ear tape. I will mark it at the right spot with a marker to help indicate any tube displacement. We will get our tape, our final fixed tape with the little things cut like that. Hold our tubing, undo the tape from the box, and you will tape it on the nose and wrapping the tape around like so. And we will clip the tubing to the patient's gown. And now I will hook up the suctioning. I will turn the suctioning on the wall, the low wall intermediate suction as directed by our orders. And you will connect the suctioning to this right here. And then have the blue pigtail always above the patient's stomach. If we are not suctioning, then we will have it clipped pinned like this, and the blue pigtail will always be above the patient's head. So now that that is completed, I will remove the towel and basin, clean up my area, lower my patient's bed back to the lowest position, raise my eyebrows, give my patient their call light, and assess them for comfort while cleaning up all my area and throwing my trash. And then I will remove my gloves, remove my goggles, perform hand hygiene, and I will document. I will document the type of NG tube I use, the size NG tube I use. I will document the time and location, which would be the right nair that I used, how we secured it, what method we used to make sure that it was in the correct spot. I would document if there was suction being used, document how my patient took the procedure and how I left my patient. And I'll also document the color, consistency, and characteristics of the secretions. So now for NG tube discontinuing, I will check my patient's orders, perform hand hygiene, and I will explain to my patient what we're going to be doing. I will auscultate for bowel sounds and perform hand hygiene and don my clean gloves. After auscultating bowel sounds, I will turn my suctioning off, undo the tape from my patient's nose. I will unclip the tube from the patient sits down. We do our tape. And then while having my patient take a deep breath in, I will kink the back of the hosing suction, and have my patient take a deep breath in and hold it, and smoothly and steadily remove the NG tube. And then I will measure the drainage of the NG tube, perform oral hygiene, and document. And then lower my patient's bed before documenting, and then I will document.